Okay, good morning, everyone. Thank you for joining us today to discuss what's new with the Secure Portal. My name is Karen Curtis. I'm a provider outreach and education specialist here at WPS. I'm joined today by my teammate, Bailey Lawson. Bailey will be monitoring the chat for questions, as well as providing you with some additional information and links. I have just a couple of things to cover before we get started. First, if you haven't downloaded a copy of today's presentation and would like to, there is still time. A copy can be found on our live events page, which is located within the WPS Training Center. Here, you will also find a list of our upcoming events. Bailey's going to add a link into the chat in case you need to get there quickly. Our training center also contains a web page for encore presentations. Videos are available for up to 90 days, and they can be watched on our web page without you having to go to YouTube. We know that some of you may not have access to YouTube from your company computer, and we want you to be able to receive the education that you're interested in. Each encore is posted with a link that will allow you to download a copy of the presentation. You will also be given another chance to complete a survey and provide feedback. Now, today's presentation is being recorded, and if there are no technical issues, then this will be posted to our website within the next few days. Later, there will be a question and answer session if time permits. If you have any questions related to today's topic, please send those using the chat feature. If there's any questions that I don't get to, or if some require additional research, maybe if I have to go back to the portal team or something like that, then an email providing those answers will be sent to everyone in attendance. Our goal is to provide you with an excellent customer experience. We want to know how we're doing, so later in the presentation, you will be given the opportunity to provide feedback on today's event. This is your chance to let us know what we're doing right. Let us know if you feel that there are areas that we can improve on. This also allows you to give us input on what types of education you'd like to see in the future. The way that I'm doing this webinar is something kind of new. I'm going to be explaining that to you guys a little bit. So I would really like to know how you guys feel about it and what you think about doing presentations with this information. Now, while this is a CMS survey, WPS does look at our results, and we do our best to make the improvements that you asked for. Here at WPS, we do our best to provide you with accurate, up-to-date education. All of the information that I'm providing is accurate as of today. I also need to let you know that CMS does prohibit the recording of this webinar. We are recording this event so it can be posted to our Encore Presentations webpage and our YouTube channel, and it will be available in case there's something that you missed or if there's information that you want to share with a coworker. So there really is no need for you to have to record it. Now, like I said, I am trying something new with this webinar. In the past, we've held webinars when there have been big changes and redesigns, but many of you want to see education on portal topics. The subject has been submitted as a topic for future education on surveys, and attendees have added in webinar chats that they would like to actually see what changes are being made. Since this is the first webinar I'm holding with this new what I would call format, I want to provide some explanation of the timelines for PO versus that of the portal team. We'll talk about access. I'll also show you some changes and new features that the portal has and give you some things that our portal team is looking to do in the future. Now, the world of Medicare contains a lot of acronyms, so I'm sure you all know that. I've created a list for those that you will see or hear during my presentation. I'm sure many of you know what all of these mean, but I've included them just in case there's someone who's maybe new to Medicare, or maybe they work in a field or a practice where they haven't need to know what these means. So if I do mention an acronym that you're not familiar with, then you can refer to this slide for reference. So we'll start with a little background information. So I wanted to provide you some behind the scenes as to how our team works with the portal team in hopes that'll give you a little bit better of understanding on how we do things here. So sometimes you may wonder why we aren't holding webinars on changes before they happen, or why we aren't providing live demonstrations before updates go into production. Now, the number one reason would be because the PO team does not have access to the production portal. There's really no reason for us to have access to Medicare beneficiaries or even your information. We do have access to a test portal. Now, everything that's in there, it's all fake scenarios. So we don't have, like, I can't log in as a provider. So things that we see are a little bit different. And a lot of times when we provide you guys with screenshots, we have to get those from the portal team because they see things differently. Now, the test portal is used by the portal team to test changes that are being made. This way, they can make sure that everything is working the way it should before those changes are moved into production. If issues are found, then those will be addressed in the test region so that hopefully production issues can be avoided. We also have very different timelines. The portal team works in 2-week sprints. So this means they can test a change and they can move it into production within 2 weeks. Now, if issues are found, that would potentially change the production date. There can also be changes that are dependent on other programs. I know there was a recent update where the on-base program had to be updated before the portal could be updated. So, that all has an effect on timelines and production dates and things like that. Now, we do meet with the portal team monthly. They let us know what they're working on. Sometimes this will include estimated production dates. Sometimes it doesn't. They let us know about issues they are having and information that they think that should be shared with the provider community. We also share ideas for education. I may say, hey, I think this is something that I'd like to do education on. What do you guys think? And, if it's something that they're like, well, we're not really showing any issues with that, they may tell me, maybe find something else. Or there are times too that they're like, hey, we're having a lot of issues with this. We think the provider community would benefit if education was provided. So we kind of share ideas back and forth. Now, lastly, we have the PO timeline for advertising. When we decide on a topic for education, we have to allow 4 to 6 weeks for that event to be advertised. Now, this allows providers plenty of time to see the event and decide if they would like to attend. So as you can see, this can make things a little bit more difficult for us to show you changes before they happen. Now, of course, with larger projects, they're working on those for longer periods of time. So we're able to get screenshots and provide education in advance. Now, we also have to watch for PHI and PII when showing screenshots from the portal. I know that I've been asked to do live demonstrations, and we don't want to show any sensitive information, even though the situations are fake. There may be some providers that are like, hey, I don't want my MPI shown on the screen during a live demonstration. So there's just other things that we have to think of before that we can do that. Now, access levels can also play a part in portal education. So I want to talk about that for just a minute. Now, a lot of what we are going to discuss today pertains to the secure section of the portal. So this means that you would have to be registered with WPS and logged in to view some of today's information. On this slide, I've provided a link to the WPS website in case you need to get registered. Now, after choosing a jurisdiction and accepting the AMA license, you will see this box near the top of the screen. Now, if you've already registered, you can enter your user ID and password and then click on the login button. If you have not registered for the portal, then you can click on the registration button that I've outlined right here for register. There are 3 user levels available. Eligibility users will have access to their own account details, to eligibility check, MBI lookup, and customer service functions. The eligibility check allows users to verify certain beneficiary information. We recently did some webinars on locating eligibility information in the portal. That encore is available on our YouTube channel. The MBI lookup tool will help when a beneficiary is unable to provide you with their Medicare number. So after entering the patient's social security number, first and last name, date of birth, then the portal will provide the MBI and options to view eligibility information. The customer service option allows you to send messages to a customer service representative. So that puts you in contact with them. Now, standard users have access to all of those mentioned, plus all administrative functions. So this is going to include things like claim status, reopenings and adjustments, appeals. You can access remittance advices, as well as other functions. And the MPI administrators, they have all of the functions of a standard user, plus management of other users' accounts. So this is going to include tasks such as approving or denying access requests for other users under the same MPI, reactivating accounts that become disabled, reminding other users when it's a time for their annual recertification, and making sure all active accounts are in compliance. Now, the reason I'm explaining all this is because our portal team, because they're testing the system, of course, their screens are all from an NPI administrator point of view. So there could be times where they could share screenshots with us that we use for education. And so depending on your user level, maybe the screens don't look exactly like what we're showing. So I just wanted to make you guys aware of that also. I do want to take a minute to talk about information that's required to create a portal account. I've gotten pre-submitted questions related to this. The portal team has also mentioned that it is an area that can cause confusion. So when you sign up for the portal, you will be asked to agree to the terms of general use. You will need to provide your MPI, PTAN, and TIN number. Now, if the MPI entered has less than 5 MPI administrators, you are going to get asked if you want to register as an MPI administrator. Now, if you choose yes, you are going to need to provide financial information that is going to appear on a remittance advice that has been issued within the last 30 days. So you're going to have to, you'll choose if it's information about a patient, you may choose to enter a check number, or you may choose to enter a claim number. There have been questions where I think people are trying to register as a standard user and they don't have access to those remittance advices, and so they're getting confused when they're getting asked to verify that financial information. So now I'm going to move on and I'm going to give you some news from our portal team. This is information from our previous meetings that they have said, hey, we want the providers to know about this. So a couple of weeks ago, there were some issues with the portal connectivity, which prevented external users from logging into the portal. So I wanted to show you where on the WPS website you can look for information regarding issues. I was able to go out there and get the screenshots while all of this information was kind of fresh. So I was glad that I was able to show you exactly what it looked like at the time. I want to start with the picture on the top right, so right over here. The first red square is around what looks like a text bubble. Now, if this is the first time that you visited for the day, a red circle will appear if there are new messages. And there's going to be a number located within that circle to let you know how many messages have been posted. You can click on that and it will take you directly to the system status page. It'll list what messages you have to read, and then depending on whether you're in whether you chose a Part A jurisdiction or a Part B jurisdiction, it will also list if there's any issues with FIS or MCS. Now also, the second box that I have here is what we call the carousel, the news carousel. And these are messages that we feel are of high importance. So this box will flip through like the top 5 news items, and you can click on the Read Now button, and that's going to allow you to read the full article. We also have, if you move down the WPS homepage, there's a system status. So here it has that there's one informational message. This has been out on the portal for a while. It's actually about viewing ADRs. So this will tell you if there are messages out there for you to read also. Lastly, we have the news and updates section down here. So that's where you can find news and updates related to any WPS topic. So my reason for showing you these is so that you know where you can look if you're having problems with the portal. You may be thinking, is it just me, or is there actually an issue with the system? So I just wanted to let you know there are places that you can check to see if it is, something with us, or if it's something internally with your office or facility. Now, during my last meeting with the portal team, here are some topics they wanted to make sure I talked about. The first one is password requirements. I'm going to click on this real quick so we can go out to the portal website. Now, I'm sure many of you, like me, dread when you have to reset your password. I just had to do mine on Monday, and it always takes a couple of attempts before I can find one that the system is going to accept. So I provided the link to the portion of the manual that contains the password requirements. Now, the reason I have this here is because for a time, the portal team was receiving a lot of messages about password issues. And when they looked it up, they found that users were trying to use one of the items that the password list cannot contain. So if we scroll down a little bit, it has that your password cannot contain your first or last name, any special characters other than these listed above, your user login, a security questions answer, or words found in the dictionary. Now this is 4 or more letters. Now, I'm sorry, for example, people were trying to use special characters that couldn't be used. Some people were trying to incorporate their login ID to their password. And so it's just stuff that's on here. It can't be used, but I just wanted to let you know where that was and to give you a link for that. Now, along with the requirements, this resource also gives you tips on creating a password. You can have the portal auto-generate. If we move down here, the portal will auto-generate a password for you. Now, this option may not be for everyone. I know that I personally would have a hard time remembering a bunch of random numbers and letters and characters, but if that's something that if you're just having a hard time and want it to be auto-generated for you, you can do that. If we scroll down here, I also wanted to make you aware that passwords will expire every 60 days. So there are steps on how to change your password, what to do if you've forgotten your login ID or password. And at the very bottom, there's some troubleshooting. Sorry. Now, in the tips on troubleshooting, it tells you that you can contact your MPI administrator to reset your passwords. MPI administrators can contact the provider contact center. And we have been told that some users are trying to contact the DDE line. The The DDE line is for DDE users only. They cannot help you with any portal issues. So these are two totally separate systems. The portal, DDE, PAYGOS, EDI, all of them are separate systems. They're all handled by different departments. So contacting the DDE line would not be an option for trying to get help with your portal password. Go back. So the second item is frequency of logins. You will want to make sure that you're logging into the portal. The portal team suggested every 2 weeks. Now there was a time where they weren't really tracking how often users logged in, but this has changed. So they are now kind of watching this. So if you log in about every 2 weeks, this is going to allow you to keep your account from being disabled or removed. The requirement is at least once during a 30-day period. So if you just kind of set up a reminder and do it every 2 weeks, then you have it covered and you won't have to worry about it. Users who become disabled are going to need to contact their MPI administrator to activate their accounts. Accounts that remain disabled for a year or more cannot be reactivated. So in this case, the user is going to have to register for a new account. The last item, the MBI lookup tool. I recently found out that when CMS created the MBI lookup tool, this was meant to be temporary. So when I started Medicare 27 years ago, a person's Medicare number or HIC number was their Social Security number with a letter on the end. If a wife was receiving benefits under her husband, then her number was her husband's Social Security number with a letter B or D. But in an effort to better protect beneficiaries' identities, CMS started replacing Social Security number-based HICs with MBIs, which are just randomly generated numbers and letters. That started happening in April of 2018. So the MBI lookup tool was created to help with this process. Portal staff have reported that this tool gets used a lot, probably more than it should be. So as a reminder, they asked that I remind everybody, excuse me, that you should always ask for a copy of the beneficiary's Medicare card at the time that service is received. Now, I know I said that this was set up to be temporary. There has been no plans to remove this tool. There hasn't been any word from CMS that they're going to discontinue it. I just didn't know that it was created for that reason, so I wanted to share that. So now let's move on to updates. There were some recent changes made to the Part B appeals letters. For standard users and MPI administrators, there is an option in the transaction column which is titled Appeals. Now, when you choose this option, you can view Part B appeal request for your MPI. Now, on the left side of the screen is what a provider would see prior to the change. So you can see in the details section, you have the Benny and the claim and the provider information. There would be a box that would tell you the decision. So in this one, it has that the decision was unfavorable. Now, as we move down to the decisions section, the system would again give you the decision and let you know that a copy of the appeals letter was sent to the beneficiary. So this letter will detail the outcome of the appeal, which will include the reason for the decision that was made, along with information about their rights to further appeal if they disagree. Letters will also provide instructions on how to proceed to the next appeal level if applicable. So now when providers log into the portal to view their appeal letters, they can view a copy of the letter that was sent to the beneficiary. So you'll notice over here on the right, there is a blue box in the decision section that says view decision letter. So clicking on this box is going to allow you to download a copy of that letter for viewing. I'm not sure how this was received in the provider community, but I know that internal staff was pretty excited about this update. CMS wanted providers to be able to see what information was in that decision letter. So that was why this change was made. Now, in 2020, a nationwide prior authorization process was put into place for certain hospital outpatient department services. Some of these services would be for like rhinoplasty, vein ablation, and facet joint interventions. There's some more of those, but that's just a few. So before a hospital could provide a service included in the prior authorization program, they would need to submit a prior authorization request along with documentation to prove the medical necessity to our medical review department. Medical review would look at the documentation and then they would either affirm or non-affirm the request. A letter would be sent to the requester, and if affirmed, it would contain a unique tracking number or UTN that the hospital would include on their claim. So you may be wondering, well, what about the Part B provider? All of this communication is being sent to the hospital. So now with the prior authorization search, hospitals and physician office staff are able to view the status of a request for a specific beneficiary. This tool is available on the public side, so there is no need to log into the portal. The prior authorization search can be accessed by the tools section in the quick links area. The left shows the tool, which will require the facility or supplier's MPI and PTAN. So if you are a doctor's office and you want to know about the prior authorization status that a hospital submitted, you can see that you're going to want the facility or supplier MPI and their PTAN. That would be the information you'd want to put in there. You'll also need the beneficiary's last name, their first initial of their last name, and the last 4 digits of their Medicare number. Now, the last item that is required is the authorization type, which is a drop-down box. If I click back onto, give me one second here. If we go back here, go to the tools, all tools, and if I scroll down to the bottom here, here is the prior authorization search tool, and down at the bottom here, it has a drop-down box. So these would be all of the services in which prior authorization would be submitted for. So I just wanted to let you look at that real quick so you knew what I was talking about. The image on the right shows the search results. So the top of the request, the top request here, this received a non-affirmed. So you can see under the status in here, it says that future claims submitted for this service most likely will not meet Medicare requirements. Now, if you look at the bottom one, this one did receive an affirmed status stating that future claims submitted for this service will most likely meet Medicare requirements. I know Bailey and I's teammate, Elaine Sigler, she recently held a webinar covering this new tool. So if this is something that you're interested in learning more about, then please keep an eye on our YouTube channel. The encore presentation should be posted soon. So the last thing I wanted to talk to you guys about today was some upcoming projects. Our portal team does have some projects they are working on for the future. Now, because these are still in the beginning stages, I don't have a lot of details and I don't have expected release dates. I just wanted to let you know what you can look forward to seeing in the future. Now, one of the projects that's being worked on is for documentation. So within the next 6 months, they are hoping to make updates that will allow providers to see rejections sooner if you have something missing in your documentation. They're also doing some work on adding a tape-to-tape indicator for Part A claims. Now, if you're unfamiliar with the tape-to-tape field, this tells us if the claim's posted to Common Working File and if it's going to appear on a remittance advice. So that is something else they're working on getting out there. And the last thing, they're also going to be working on creating an IPPS outlier tool. This project is still in the discussion phase, so I really don't have any more information to share about it, but I know that there are a lot of issues with outliers, so I'm sure any tool that could help with that situation would be very helpful. Well, that brings us to the end of what I have to present today. So I'm going to ask Bailey if we have had any questions come through in the chat.
No, Karen, there's been no questions.
Okay, thank you so much. I will go ahead and move on. So after the close of today's webinar, you should receive a thank you for attending email, and this is where you're going to find your proof of attendance and contact hours. We don't issue continuing education units, but this information can be sent into your crediting body, and then they would use that to determine what CEUs would be issued. This also contains a link which provides you an opportunity to give feedback regarding this webinar. If you don't get this email, please check your spam or junk folder. You'll also need to add messenger@webex.com to your safe sender list. That will help you avoid any issues in the future. If you joined only by phone, you will not receive this email. So please send an email to the education mailbox and include your name and the phone number that you use to join. That way we can email you a certificate that can be used to send in. Now, if you do think of any questions after the webinar, you do have 7 days to send those in. You can email those to the education mailbox shown here on the screen. Be sure to put today's topic in the subject line so that staff knows that your question is related to this webinar and they'll send it directly to me. If you have anything that is claim specific, then those would need to go to customer service. Now, when you disconnect from the webinar, you will be redirected to a CMS survey. I'm also having Bailey add that link into the chat. Now, your feedback really does mean a lot to us. Like I said, this is something new that I thought I would try just to kind of see if it's something that the provider community is interested in, if they want me to continue doing something like this. So if you could provide feedback, that would be great. This also gives you an opportunity to let us know what topics you'd like to see us provide education on in the future. So if there's something specific, please let us know that. Also, if you have ideas that you think would improve how you receive your education, be sure to tell us that too. Now, the redirect does look like what you see right here in the middle. We don't have any control over how this appears, so we just want to let you know it isn't spam, it's nothing malicious. It does have CMS, and this is their Qualtrics website, so just so you know, that will pop up when the webinar ends. That brings us to the end of today's presentation. On behalf of myself, Bailey, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you will join us for future events. Have a great rest of your day. You may now disconnect.